agenda the minutes of the April 2nd meeting for approval.
Motion to accept?
Second?
Yep. Second, thank you. Motion of the minutes approved. The next item for review is the tobacco control monthly report submitted. Any questions on the tobacco control report?
So, is the owner from Two Brothers Smoke Shop have to come in front of us? Is that next month?
So he will be at the next meeting because he is going to appeal the $2,000 fine, so he will be at the next meeting. He has asked for a hearing. So that's why Caesar's not here tonight, because they will be at the next meeting, because there'll be a hearing for that.
And I didn't know that we had officially started fining for the kratom, so we had Kratom, whatever.
Yes, so he was the first one, because there were, and then Caesar will talk about that. And the $2,000 fine was actually for a minor going into the store, so that was what that fine was for.
Okay, but the violation, so there was a violation in March and April, right?
Yep.
Yeah.
So the one in
it's-
April is his second offense for the minor under 21. And I think it's within 6 months, because wasn't he here the date we passed that? Or it's at least within a year.
Right, the first, yeah, he's been here for other things
Yeah.
as well, so there's been a few violations, correct?
Okay. Any other questions on the tobacco report?
Cost them some money.
Yeah. The next item on the agenda is the monthly development services report submitted by Matthew Sheehan. Good evening, Matthew.
Good evening, everybody. Madam Chairwoman. As you can see in the report, we had 5 new restaurants or changes of use. We had 1 Ansel system activation at a Wendy's on Rogers Street. We did find 1 food truck, myself and the team, operating without proper permits. They actually had no permits. And the code violations were so egregious that I will be bringing them in front of you folks before I even grant them a food permit. So I will write up all my findings. I will print out all the pictures that I did see, but I did tell the gentleman that I was adamant that he would come in front of the Board of Health before a food permit was granted, just based on the stuff that we saw. A quick update about Northwood Rehab out of Varnum Avenue. One of my team members was out there today, and they have everything updated, everything that we requested from our last few food inspections. Everything is good, up to date, so it has finally passed the food inspection on our end. They did have pest control plan in place. There was company was out there the end of March and the second week of April. So we will be going out there every few months just to make sure everything is on the up and up.
How much was the fine total? How long did it take them to straighten it? How long did it take them to get it straightened out?
So they received in total, I believe, about $1,000 worth of fines. I was out there a week ago, and the last bit that we were requiring was the update to the Ansel system. I had explained to the staff there that if the Ansel system wasn't updated within a week, that it was $1,000 per day.
So they never got to that then?
No, they did not. I also submitted in the packet the brief presentation that we did in front of the City Council last week. And what you see in front of you is we went back into the school system for the month of April. Several schools did pass. However, we did have some that failed. The reason for expired fire extinguishers, and a failed hood system. One of them, the McAvenue, has passed. They passed on 4/28, so they're all set. The Maury, I went into Monday. They passed. They're up to date. They are all set. But as of myself writing this report, you still have the Pawtucket, the Shaughnessy, and the Moody that are in a failed status. Now, I was told by staff that the fire extinguishers would be replaced this week. So, go ahead.
Are we able to send a letter to someone to come to the next meeting to discuss a better plan for this so that this doesn't keep happening? Who would we send a letter to?
So I guess I would send a letter to Mr. Underwood or Mr. Leahy.
Okay.
Because as you noticed on some of them, I've been in the schools 3 times. This will be 4 times for some of them.
Wasn't Mr. Underwood here?
He was
And
here.
didn't we talk
and
about fire
he's-
extinguishers at that
He was
time?
here, and he said he was adding it to the list of the janitorial duties. Never mentioned that they had a contract with
I believe it's Impact Fire that works
Impact Fire,
for city schools.
and it's now May, going into June, when school is dismissed, and they're still not
Correct,
updated.
correct.
So,
And I make it a point,
Not
I take all pictures. I take pictures of everything that's expired, and I put it in my report that I send to the necessary people in the city, just showing them, where they are. So I'm hoping next week, everything will be up to date. I still have a few schools that I haven't been into yet. It's less than 5, but, I'll get those done this month. What you don't see on here, because after I submitted this report, I did go to the high school, that failed as well, for an expired hood system, as well as some, again, fire extinguishers.
Would you like to make a motion to request Mr. Underwood come?
I would like to make a motion to request that
second.
Mr. Underwood be present at the next meeting to discuss how we can better facilitate this. Thank you.
With a plan.
Yeah, so apparently, unbeknownst to us until recently, when I inquired about it, they have a contract with a company that is supposed to ensure that the fire extinguishers are up to date. And they have been having conversations with this company, but, and they're, obviously, the school department is paying this contract. And so it's curious as to why we've had all of these schools that have expired fire extinguishers.
But my point is, they've known that these were expired since October.
Right.
I don't know the exact price of a fire extinguisher, but I guarantee it's reasonable to exchange themselves if said company is not doing it, and then maybe they could have billed the company for reimbursement if they're not doing their job. I don't understand why this has to be so complicated. It's a fire extinguisher.
Right.
Exactly.
I don't want to speak for the school department.
Right.
I'm really not sure. I mean, if this were, a mom and pop restaurant, myself and my team, we'd come down pretty heavy on them.
Right.
So the Shaughnessy and the Maurice expired on 10/24, but that would have been their last inspection, right? Weren't they inspected in October?
Yes. So I believe we did the inspections towards the beginning of October, so you have the whole month to get them, replaced.
They weren't expired then, but they knew they were coming, and there were others that were expired that they had not replaced.
Right.
Right,
So
exactly.
if it expired that month, let's say I went on the first day of the next month, you would get hit for that. It's expired. The bottom line is it's expired. But if we're in that month when it expires, it's almost like tit for tat. We're not going to write you up for that, but
And these are the same fire extinguishers that you found in October that are
yes, ma'am.
expired?
Yes, yeah. And I make sure, like I said, I take a picture of everything to back up where I send it, so.
It's like, why can't we just set 2 dates? Like, we're gonna come and do all of the extinguishers in all the schools in October, and then we're gonna come back and do all of them in April, and then they won't be expired during the school year.
Right.
I mean, that'd be something between the school department and their contractor, because fire extinguishers are good for 1 year.
Right.
Ansel systems are good for every 6 months, and then depending on the kind of kitchen equipment that you have, your hood systems range anywhere from 30 days all the way up to a year.
I mean,
We're just saying that's got to be a pretty lucrative contract. I'd be asking that company to be replacing them every August. Why would you not just do it every August?
Right.
Agreed?
Anyway, we can ask Mr. Underwood that. So she made the motion, second already.
All of the
Yep.
Aye. Okay.
I mean, can we cut out the middleman? Do we have to go through this, do they have to go through this company? I don't understand why
They're tolerating.
why are they even paying this company? It seems like a pretty easy thing to do.
Again,
Yeah,
I'm
so,
not privy to the contract, so I don't know what
Right.
kind of language they have in there.
so we'll have
Could
to
we get
get,
a copy?
Future city council.
so what we need is,
Should I light?
the school department representative to come next month and tell us how they've resolved the issue for the future.
Also, can we look at the contract? Is that within us to like see what the contract actually states? I mean, if the company is in violation of,
I don't know if we can see the contract, but we could request that somebody from the company come with them, right?
right, I mean,
If there's an issue with the company being able to do it, then maybe they can come.
if they're gonna blame it on the company for not doing their job, then we should probably talk to the company as well.
I mean, that's what we did with Airmark.
That's what we do with Airmark. So,
We didn't need a motion for that.
okay. Motion.
Yes, second.
All in favor?
We'll
Just
do
want on the
those
record, it's not me
invitations.
fired up today, it's all of them.
Okay.
All right.
Is that all?
That's it.
Okay, thank you.
Thank you, everybody.
Thank you, sir.
He said he'd send the letter, so I'll follow up.
What's that?
He said he'd send the letter, so I'll follow up.
He said
He
he'd,
I'll send the letter.
what letter?
So I break in.
Doesn't have to come from the board. Don't you have to send it from the board?
Yeah, the invitation should be from the board to both of them. Just an email.
Who it is. What, yeah, I could probably just put it in the letter. I don't know the company.
The next item on the agenda is the Pride Star report and notifications submitted by John Kelly on the overdose report, and we have March and April in the packet. And it seems like we had a little bump up in March and April.
It's less than the April a year ago, though.
Yes,
So,
yes, thank you.
you're welcome. Just silver lining and everything.
Yeah.
Static.
The next item on the agenda is the PNM Railways yearly operational plan with regard to pesticides. Any questions? Okay, moving on to old business. The first item is the EMSL analytic report on the Pawtucket Memorial School with regards to their testing for mold. Results look good. Any questions? The next item on the agenda is the Cashins report. In the packet was a letter that we sent on April 8th to both Suffolk and Cashins regarding, and Skanska regarding not receiving the indoor air quality reports for the high school in a timely manner. And so we have March and April in the packet. Any questions?
No.
Looks like other than some excess dust in the stairway, there, issues with the volatile organic compounds has improved.
I would like to comment, I do like the fact that Penny Chung gave us a quick little summary of the issues rather than making us look at every line, so
Yeah.
it was good, thank you.
Next item on the agenda are the departmental divisional reports and updates. The first one is the Public Health Division report and update.
Just like to say Happy Nurses Week to the nurses on the board. Thank you. And the city will be offering free coffee at Brewed Awakening on Friday. I believe it's from 6:30 to noon. A free coffee for nurses. Welcome. And I believe in here are the numbers for, the updated numbers when this was done for measles. I think is in here
Yes,
somewhere.
the measles
Yep.
update is in here.
Yep. Also, we did get word, I believe it was in the Lowell Sun last week, that the ICC will be, initially, we thought the ICC will be closing at the end of the year in December, but the ICC will be closing June 30th. I believe the number is down to around 200 individuals in there, and we have been told that everybody would either be found housing or moved to other hotel situations, that nobody would be left without a housing situation,
Thank you.
either temporary or permanent. But they will leave June 30th.
With regard to measles that you mentioned, it's great that the school nurses in Lowell ensure vaccinations are up to date. I think it's unacceptable that there are 884 cases of measles reported in the United States so far this year. Certainly a vaccine-preventable disease with, 3 children dying of measles, totally unnecessary. And I think it's important that we have those school nurses there and they're ensuring that kids are getting vaccinated. Just editorializing.
Really?
The other comment I have on the public health nurses report is, I think, so, in terms of the active TB disease cases, so there were 4 active TB cases reported in April, according to this, and again, the data's obtained from Maven, but 0 contacts identified. So, unless those were all extrapulmonary cases, I would say, can we take another look? And maybe it's just a paper trail issue that those contacts have not been entered into Maven yet, and so the data isn't being spit out in terms of contacts identified. But, in January, there were 2 cases reported with no contacts identified. I would suspect that everybody has maybe at least 1 or 2 contacts. The average case has at least 4 contacts. And so, Madam Director, if you could just ask the public health nurse that question, I would appreciate it.
Right, and it may not be that it's, I mean, yes, everybody does have a contact or a house contact or something like that, and I believe that the number would be higher if we were counting, like, how many contacts people had. It may be how many contacts are being treated or something like that, so there might be, we probably just don't know what the number means, because obviously each person has more the number should be higher if it's how many contacts each person actually has. The number should be higher.
Right.
Then we need to know what the definition.
Yeah, so we just need to know the definition of what it is. So we'll get what the definition means.
Yeah, and it may just be like, that the public health nurses have identified the contacts and they just haven't been entered into Maven yet. I don't know.
No, we just need to know what the definition is,
Yeah.
because that's not what that means. Yeah, so we'll get what the definition is.
Okay, I'm just
Yep.
curious.
Thank you.
It's not what it means, we might need a different name then.
Yeah. It's not what we're thinking.
It says contacts identified, it doesn't say
Yeah.
contacts on.
It's not what we're thinking it is.
Anyways, and then clearly there is a huge drop in refugee arrivals since January of 2025.
Yes. Yep. And then on when we were talking about the measles cases and the school nurses and keeping track of it, this week we actually had the ribbon cutting for the van that's going to be going to the schools, to the 6 schools. And I believe one of the Board of Health members was there. It hasn't actually gotten to the Lowell Sun yet. So the van that's being run by UMass Lowell health students and also by Lowell Community Health is actually out and has gone to some of the schools that will be doing physicals, also doing some vaccines, and will be running through the summer. So we'll be catching up some of the kids with vaccines prior to entering school. So that's going to be a big thing to making sure that some of the kids are up to date and getting them into school quicker as well. So, and that's in lieu of getting school-based clinics in the schools, where we have one Lowell High and also one at the Stocklosa School, because we can't take up any space in the schools, and we don't have nurse practitioners that we can put in all the schools. The school-based van will be on the street 5 days a week and going to different schools. And even if a child is at one of the schools that doesn't have it, they could go to a different school and be seen on the van at a different school. And then we still have the vaccine clinic at Lowell General at the main campus, at the PD, on the PD floor on Tuesdays and Saturdays, which is fabulous at catching up the kids that can't get into their pediatrician. So we have a lot of options, and we're very
Yeah,
lucky.
that's great.
Yep.
That's great, and that's why we have a good vaccination rate. And,
Right. Exactly.
It's accessible.
Erin, did you have anything else to add? I wasn't at the ribbon cutting. I was at something else.
It is an awesome collaboration between Lowell Community Health. The UMass Lowell nursing students are able to like get hours from it. And then kids' sick visits if they need it right before going back to school. I'm sure it'll help us for the physicals, getting them back into school in the beginning of the year, and like sports physicals and all that. It's great collaboration. Ooh.
They'll have UMass Lowell nursing students working there, I
Yep.
think.
Yep.
Nice.
Yeah. Thank you.
Thank you. The next report is the School Health Division report. I think we sort of, any questions on School Health Division report? And the final division report is the Substance Abuse report. So far this year, we've collected 4,827 syringes.
Yeah, I believe Andre said we should be close to 100,000 soon, so I'll let you know when he hits the 100,000 mark.
So here's the question for you. Has the city, and I guess we could ask the paramedics too, but has the city seen a decline in needle-related injuries and instances since we started this program?
I'm not sure.
I mean,
We'll
it
have to
would
find
seem like
out.
it would make sense, but I'd be curious to know if we can actually say, hey, look, we were averaging 3 a month and now we're down to 1 or none, right?
Yeah, yeah,
If that's even quantifiable, I don't know if it is.
right.
I wonder how that would be collected, like emergency room or doctor's
Yeah,
visits, you know?
might be EMT visits certainly, or it could be emergency rooms, yeah. If it's an emergency room, it gets harder to figure out, but.
People are very proactive about calling when they do see them, and now with the 311 system, so the city has the 311 system. If you see a dumpster or an overflowing dumpster or pothole or street light out, you can report a needle being seen as well. So it does come on the mobile app that you can report a needle out in the street or anything, and that will go to an email to me and to the syringe coordinator, so that is something that can be reported as well. And people are reporting that
That's
as well.
great. Maybe
Yeah.
we should add expired fire extinguishers to that. 311.
Oh, I have a question. When the MBTA did the cleanup
Yeah.
of that area down there, they had left, I think they said they left behind the needles and propane tanks. Is that, like, does Andre include that in his count? Because who disposes of those if they just leave them there for the city?
So that wasn't, yeah. So that wasn't the MBTA. So the MBTA did along the Merrimack River. So they picked up everything along the Merrimack River. That was the cleanup at Arch Street. So Arch Street, Andres helped with the needles at the one on Arch Street at, well, we call it Arch Street, but it was Dutton Street, Dunkin' Donuts, and Andres did help with some of the needle cleanup there. And the propane tanks were being picked up by DPW. But then what happened was when people knew that the cleanup was happening, they also went and dumped their propane tanks there. Little illegal dumping, so, yeah.
So fun.
So, but Andres was there to help out with that cleanup.
I don't know if they just had like a bucket that they like left for him.
I'm not sure. I know he was there when it was happening, and then I know it had to be aborted with some of the winter and some wet weather and things like that. So he had gone back and forth with some of that. It was a pretty big hit for him with a cleanup there. So, yeah.
Director Golden, any other updates from the health department?
No, I think that was all I had. Thank you.
Do we have a motion?
Motion to adjourn?
Second?
Wow, that was close to one of your, that was one of your best.
Meeting adjourned.